This is an ultrasound exam of the thyroid gland in a patient referred from the ENT specialist for examining the thyroid gland. The chief complaint of the patient is dysphasia. The patient was later diagnosed as achalasia, and here how the diagnosis was suggested by ultrasound. Here we see the thyroid gland left lobe, and we see that the size is nearly normal with some sub-millimeters nodules. This is a longitudinal section in the left lobe, and here's a transverse section at the midline showing both lobes and the isthmus. What we see from the first section here is that the esophagus is slightly dilated, and here we see the anterior wall of the esophagus, and this is the echogenic line of the contents. Usually we see the esophagus posterior to the left lobe, and we see both anterior and posterior wall. Here we see only the anterior wall and echogenic line, which is air inside the lumen, but we don't see the posterior wall, so this esophagus is dilated. In this transverse section at the midline we see the esophagus here posterior to the right and left lobe. Here is the acoustic shadow of the trachea. So the anterior wall of the upper esophagus is from here to here. It is very big. Normally we see most of the lumen of the esophagus only posterior to the left lobe in this site. This is the diameter of the seen esophagus here, and here a longitudinal section of the right lobe. We see the anterior wall and the echogenic line behind it, and cometal artifacts, which means that this echogenic line is intraluminal gas. Here is a transverse section of the right lobe, and here we see both the right and the left lobe. So this appearance here is abnormal, and let us see what is the normal appearance in normal patient of the esophagus. Here we see a transverse section of the thyroid gland. We see both lobes. This is the right lobe, this is the left lobe, and this is the trachea. Right lobe, left lobe. And here is the normal appearance of the upper esophagus behind the left lobe of the thyroid gland that we see in normal patients while doing thyroid gland ultrasound. We see anterior wall and posterior wall, and this is the lumen, and we see about 2/3 of the diameter of the upper esophagus behind this lobe. So this is the appearance of the normal esophagus, which is collapsed and not dilated we don't see any contents inside it. Here we see a longitudinal section. At this point, behind the left lobe, we see movement of the contents of the esophagus while the patient is drinking a small amount of water. Also here, with transverse section, we see the esophagus and the movement of the contents inside it in normal patient. While the patient is swallowing fluid. Here we see in longitudinal section of the left lobe of the thyroid gland, we see the shadows of the cervical vertebrae, and here we see the movement of water inside the upper esophagus while the patient is drinking water. This is another view by slow motion. We see passage of water inside the upper esophagus behind the left lobe of the thyroid gland. And now let us return to our patient with achalasia. We see how different is the appearance here. So achalasia is suspected, and I did an ultrasound of the lower esophagus after the patient drank a lot of water. Here we see the the stomach filled with water. By the subxiphoid view, we see the stomach. And this is the lower esophagus, this is the IVC, and this is the liver. Here we see the lower esophagus, which is dilated, and the stomach, which is filled by water. And here we see narrowing of the lower esophagus at the level of the sphincter. This confirms the diagnosis of achalasia. The diameter of the dilated esophagus is about 4 centimeters here. And hereby apical four-chamber view of the heart, we see the dilated esophagus behind the left atrium, which is a rounded structure with thick hypoechoic wall anterior to the spine and posterior to the left atrium. This confirms the sonographic findings which we saw in this 57 years old female patient with chronic dysphasia. for about 1 year. This is parasternal long axis view of the heart. This was a subxiphoid view of the sphincter of the esophagus. At this level, here we see the dilated esophagus with fluid before the patient drinks water, and narrowing at the level of the sphincter. So achalasia can be suggested by ultrasound by examining both the upper and the lower esophagus.